Prof, good morning to you, joining us via Skype. So, what are precautionary measures that are being taken by universities to try and prevent any infections on campus?
Thank you, Julian. I think we have to start by saying that it's almost impossible for universities to insulate themselves, from the infections, if you like, if the infections do accelerate. But having said that, I mean, each of the universities is now kind of working together with the NICD and other bodies to try and work out what would be the best routes to take to ensure that that students and staff are relatively safe. Our major approach is really to say, let's listen to the science. So when I heard about people boycotting Chinese restaurants and so on, that's very dangerous. So we have to listen to the science, and we'll follow very closely what the NICD says. But at the same time, we aren't waiting for a crisis. I mean, the universities are all working on plans to try and understand how to deal with the situation if it does escalate at a rapid rate.
Prof?
So, yes.
All right. Sorry to interrupt you there. You're saying you're working very closely with the NICD. I'm keen to hear what exactly is coming from them. What are they saying should be the precautions universities take?
Okay, so at the moment, we're still in what you might think of as this containment phase, which is to say, let's try to avoid sort of international travel. Let's try to avoid having large conferences and so on. And universities are all working on that. In fact, even USAF, which has regular meetings, is now reviewing whether those meetings are absolutely necessary or not, and whether we can start using video conferencing much more to try and ensure that there isn't this opportunity for the virus to spread. But at the same time, I think the news that we got this morning yesterday from the Minister of Health, Zweli Mkhize, is really important, because what it means is that we don't have a single case yet in South Africa of kind of a transmission within the country, if you like. So that's very important. All the cases are people who've traveled in. So today and tomorrow, we're kind of really trying to make some assessments of what to do in terms of conferences, in terms of many of the universities have already taken steps to prevent staff and students from traveling to countries where there's high risk. Others have actually indicated that they will be taking steps to prevent all international travel, both inwards and outwards.
Prof, being a student myself at one of your institutions, I noticed this week that you have suspended your biometric system, where you show your card and then you put your finger there. I suppose that's part of the precautionary measures, but won't that compromise security?
Yeah, I think that we have to just do what's the best thing to do at the moment. And to try and ensure that that we deal with this current crisis as best we can. But it's also about educating students. It's also about saying to students, take care now. You have to wash your hands. You have to make sure that you're not touching spots that might transmit the virus onto you and so on. Because a lot of the responsibility is actually going to lie on the students and staff themselves. So some of the universities have taken that step, and I think that that's correct, because what it does is that in addition to kind of reducing the risk, it also begins to educate, if you like, say to students, you have to start taking this responsibility, if you like.
All right. Thank you very much for your time. That's Professor Ahmed Bawa. He is with the Universities South Africa, leading that particular institution. All right.